You just found out you're pregnant. And somewhere in the back of your mind, or maybe right at the front of it, screaming, is one thought. I was still on Ozempic. I didn't stop in time. What does this mean for my baby? Maybe you didn't even know you were pregnant until 5 or 6 weeks in. Maybe you only just found out today. Maybe you've been lying awake at night running worst-case scenarios through your head, too scared to Google it, too scared not to. I want you to take a breath, and I want you to stay with me for the next few minutes because I'm going to give you the honest, clear answer that you came here for. Not a PR statement, not vague reassurances, the actual truth about what we know, what we don't know, and what you need to do right now. I'm Dr. Anna. I've been a practicing OB/GYN for over 15 years. And the question of Ozempic safety in pregnancy is one of the most urgent questions landing in my inbox right now. Because this situation is happening to more women than you'd expect. You are not alone in this. And you deserve a straight answer. Let's start with what Ozempic actually is, because understanding the drug helps you understand the concern. Ozempic, and its higher-dose sister drug, Wegovy, contain a molecule called semaglutide. It belongs to a class of medications called GLP-1 receptor agonists. Think of GLP-1 as one of your body's natural I'm full signals. After you eat, your gut releases this hormone to tell your brain to slow down, tell your pancreas to release insulin, and tell your stomach to take its time emptying. Semaglutide mimics and amplifies that signal, keeping it switched on far longer than your body would naturally. That's why these drugs work so well for weight loss and blood sugar management. They're genuinely effective. And for many women, they've been life-changing. But here's the thing about pregnancy. Your body is doing something extraordinary, building an entirely new human being from scratch, using signals and pathways that are exquisitely sensitive to hormones, nutrients, and growth factors. The GLP-1 receptor isn't just in your gut. It's found in tissues throughout your body, and it's also present in developing fetal tissue. Think of it like this. The construction crew building your baby is listening to signals from your body the entire time. Ozempic is a very loud, persistent signal, and right now, we're still learning exactly what that signal does, or doesn't do, when it's present during the most critical weeks of fetal development. This is the part where I have to be completely honest with you. And honest sometimes means saying, we don't have all the answers yet. Here's what's actually going on inside the research landscape right now. Ozempic and Wegovy have not been formally studied in pregnant humans in clinical trials. That's not unusual. Most medications haven't been, because deliberately exposing pregnant women to untested drugs in research trials would be unethical. So what we have instead is a combination of animal studies, early registry data from women who became pregnant while on these medications, and what we understand about how semaglutide behaves in the body. The animal studies, done in rats and rabbits, did show some concerning signals. At doses comparable to human therapeutic doses, there were increased rates of fetal growth problems, skeletal abnormalities, and pregnancy loss. That's why the drug labels carry warnings about use in pregnancy, and why regulatory agencies like the FDA classify semaglutide as a medication to be avoided during pregnancy. Now, and this is important, animal studies don't always translate directly to humans. Our biology is different in meaningful ways. The doses used in animal studies are often much higher relative to body weight than what humans actually take. So these findings are not a death sentence for your pregnancy. They are a reason for caution and close monitoring. There's a difference. The human data we have so far is limited but not uniformly alarming. Early pregnancy registry data, which tracks real women who were on semaglutide and became pregnant, has not shown a dramatic, clear signal of widespread fetal harm. But the numbers are still small, the follow-up is still short, and this research is ongoing. We genuinely don't yet have the kind of large, long-term data that would allow any doctor to say definitively, this drug is safe in pregnancy. And here's the part most doctors don't explain clearly enough. The timing matters enormously. The first trimester, particularly those first 8 weeks, is when your baby's organs are forming. The heart, the spine, the brain, the limbs. This is the period of highest sensitivity to anything that might interfere with normal development. Exposure during this window carries a different risk profile than exposure later in pregnancy. If you stopped Ozempic the moment you found out, or if your exposure was brief and early, that context matters. Let me walk you through the concerns your doctor will be thinking about, not to frighten you, but because you deserve to understand what's being watched for. The first concern is fetal growth and development. In animal studies, semaglutide was associated with reduced fetal growth. This is something your OB will monitor carefully with ultrasound. checking that your baby is growing on the right curve at the right pace. The second concern is calorie and nutrient intake. One of the main things Ozempic does is suppress your appetite significantly. During pregnancy, you need to be adequately nourished, not just for weight gain, but for the vitamins, minerals, and energy that support fetal brain development, organ formation, and healthy growth. If you've been on Ozempic and your appetite has been dramatically suppressed, your doctor will want to assess whether you've been getting enough nutrition and help you correct that if not. The third concern is that semaglutide has a long half-life. This means even after you stop taking it, the drug continues circulating in your body for several weeks. Your last dose doesn't mean immediate clearance, which is why the recommendation to stop 2 months before trying to conceive exists, to give your body enough time to fully clear the medication before early pregnancy begins. And the fourth is something that often gets overlooked: nausea management. Pregnancy nausea plus Ozempic nausea together can be genuinely difficult to manage, and severe nausea or vomiting in early pregnancy already carries its own nutritional risks. Your care team needs to know you are on this medication so they can monitor and support you appropriately. None of these concerns mean your pregnancy is in trouble. They mean your pregnancy needs informed, attentive care, and that is completely achievable. If you are pregnant and you've been taking Ozempic or any other GLP-1 medication, here is exactly what to do. Clearly, in order. Stop the medication now if you haven't already. Don't taper, don't finish your current pen, don't wait until your next appointment. Stop it today. Call the prescribing doctor to let them know, and they can guide you on any additional steps. Contact your OB/GYN or midwife as soon as possible, ideally within the next day or two, not at your standard first prenatal visit timing. Explain that you were on a GLP-1 medication and you need an earlier appointment. Most practices will prioritize this. If yours doesn't, advocate for yourself clearly. I was on semaglutide and I need to discuss early monitoring. Be honest about the timeline. Your doctor needs to know when you started the medication, what dose you were on, when you took your last dose, and roughly what week of pregnancy you were in during your exposure. This information shapes what monitoring your pregnancy will need. Expect more frequent ultrasounds. The good news is that if additional monitoring is needed, the tools exist. Growth scans, anatomy scans, and closer check-ins are all standard management approaches for pregnancies with any kind of early exposure concern. You're not just going to be told, good luck and wait. There's a structured, watchful path forward. Focus on nutrition now. If Ozempic has been suppressing your appetite, it's time to consciously and gently work on nourishing yourself. Small, frequent meals, foods that sit well with you, prenatal vitamins if you're not already taking them, and tell your OB if nausea is making that difficult, because there are options for that too. And please, don't spend the next several weeks spiraling in guilt or fear. You didn't know. Many women don't know. The medication was prescribed to you by a doctor. The fact that this information wasn't clearly communicated is a failure of the system, not a failure of you. Most women in this situation do not need to rush to an emergency room. But there are specific signs that mean you should seek care the same day. Not tomorrow, not after the weekend. If you are experiencing severe, persistent vomiting and you cannot keep any food or fluids down for more than 24 hours, that needs urgent attention. Dehydration in early pregnancy is serious, and it can develop quickly. If you have any bleeding or spotting along with cramping, go in. This could be completely unrelated to the medication, but it needs to be evaluated promptly. If you have not been able to reach your OB/GYN and you have significant concerns about your exposure or your symptoms, go to an urgent care that handles obstetrics or your nearest maternity unit. You do not need to wait and worry alone. If you were taking a high dose of semaglutide and you have a history of prior pregnancy complications, fetal growth restriction, recurrent miscarriage, gestational diabetes, please prioritize getting seen sooner rather than later and make sure your full history is in front of your doctor. When you do go in, expect a blood pregnancy test to confirm levels, an early ultrasound to date the pregnancy and check that it's properly located in the uterus, and a full medication review. Your doctor may also check your blood sugar levels, since many women on Ozempic were using it for insulin resistance or prediabetes, and pregnancy changes how your body handles glucose significantly. You will walk in with information and questions. That is the right way to walk in. You are not a passive participant in your care. You are an informed person making decisions with your doctor. Here is my honest answer to the question you came here with. Is Ozempic safe during pregnancy? The truthful answer is, we don't yet have enough data to say it's safe. And there are enough signals from animal studies and pharmacological reasoning that the current medical consensus is to avoid it during pregnancy and stop it as soon as a pregnancy is confirmed. That does not mean your pregnancy is automatically at risk. It means your pregnancy deserves careful, informed, monitored care. And it means you deserve a doctor who takes this seriously, not one who brushes you off. If you found out late, if you were exposed in those early weeks without knowing, you didn't do anything wrong. You were taking a medication your doctor prescribed, and this is a gap in how that prescribing conversation should have happened. Many doctors are still not having this conversation proactively with their patients. That needs to change. What matters now is what's in front of you, and what's in front of you is a pregnancy that deserves attention, care, and hope. Drop your questions in the comments. If you're going through this right now, tell me where you are in the process. I read everything, and your story might help someone else feel less alone. Share this video with anyone you know who is on a GLP-1 medication and either pregnant or thinking about trying to conceive. This information needs to reach more people. Subscribe for more honest conversations about your body and your health. I'm here every week. I'll see you in the next one.